she was in this video. I don't know where we can find it. I still haven't seen it, but
I don't know when it'll be out, but it's in the process of being made.
okay. Okay, so we'll be looking for that on the market soon. Also, okay, some more ways to cope with this age-progressive disease. Setting small practical goals, and high self-efficacy. We've talked about a little in this class. It's really important. She feels that she has confidence in performing things that she needs to do. It just might take longer, but she feels confident about her ability to do it in the long run. Okay, so the sociocultural dimension of health through her self-management. She uses social support. Okay, so both informal care, from friends, family, and formal care from paid helpers. And has spoke about this topic and been invited to conferences to talk about how to manage working with formal helpers. What do you call them? Personal care aides. Okay, and like just her trials and tribulations with that. They've had a lot, and talking about those kind of things and what they do as a family. Employment. Yeah, she said she's an independent promoter of FA awareness. That's her title, and it's also probably going to be co-teaching a class next semester, hopefully one of the Odyssey first year classes. So I probably won't see any of you in there, but
Hopefully, yeah.
yeah, and talking about possibly neurological. With Dr. Pritchard. Yeah, and he's heading it up, but she's going to help actually be teaching and planning out the class and all of that. So hopefully that works out. And self-management of environmental stressors. So yeah, medication management, that's an issue, and needing to maintain a heart-healthy diet. And also having a clean, healthy home, healthy relationships is important to just coping and self-managing stress that comes along with this. Proactive coping, and she does emphasize social support. So it has to do with just being with people, getting support from friends, family, laughing. We do that a lot. Education, and this is actually, I love this picture with the dogs. This is her and her sisters, Becca and Katie, and with their rambunctious dogs. And this is us at a conference, this gerontology conference. So yeah, she stays connected with friends and family, and very important. Okay, so some options that potentially delay degeneration, antioxidants she might take, CoQ10, vitamin D and E might slow symptoms, bracing or surgery sometimes to correct bone deformities, scoliosis and things like that, and physical and occupational therapy. So let's talk about, Robbie's going to talk about her own experience. She did show slight signs at age 5 that her mom picked up on because she had a background in physical therapy. She noticed mild foot deformity, and she was walking with her feet farther apart than normal. Okay, so that gait problem. This was before genetic testing was available. Diagnosis of the degenerative disease was kind of like a wait and see game. Like, let's see, how is this going to progress? What's going to happen? And by age 9, so 4 years later, a specialist ran neurological tests and thought that FA was the likely diagnosis. And her progression, it started with a poor balance, like she mentioned, but she still continued to play on the playground. She could run a little bit until the progression worsened, and she became embarrassed eventually about the incoordination, maybe feeling clumsy, I guess. I don't. And so at age 12 is when she started to use a wheelchair part-time. Okay, and then she was diagnosed with mild cardiomyopathy and had scoliosis surgery at 14. And here she says, I really like this, please understand that when ability becomes frustrating, dangerous, and eventually impossible, one can look back and remember the hardships and challenges involved. Therefore, I try to focus on what I can do now at this very moment. Okay, so this is what she has abilities now. She focus on that, and that's a good way to manage that. Post-ambulatory, started using the wheelchair. So started part-time at 12 and started full-time using the wheelchair at 13 because she was having a lot of falls and thought she should. At age 20, she could transfer on her own, and she was able to drive her car in high school. Okay, because there's such a big variation in symptoms. Not everyone can do that. It just happens. Age of onset for these things are very different for everybody. Yeah, and then the formal support services we kind of touched on. The personal care assistance, it's critical if you have advanced FA. And Robbie and Becca definitely have, we have somebody here taping us, excellent PCAs who allow them to have their own lives and do things that they enjoy, help manage medication, food prep, take doctor's appointments, taking them, driving them places. And there are a lot of, how do you actually fund it? Well, there are a lot of community-based waivers, through Medicaid to provide financial support to receive funding for PCAs. It's different by state. Okay, so the one that they use is the Independent Care Waiver Program. Okay, so what's the future of FA? Biomedical research is needed, still needed. Researchers are hopeful. And some of to show the progress, in 2004, there was only 1 clinical trial and 3 potential treatments. And in 2010, there were 7 clinical trials and 8 potential treatments. So you see kind of an increase in that. The research, it's the Friedreich's Ataxia Research Alliance, FARA. And in some cases, heart surgery might increase life expectancy. So if you're interested in that, this will be on the slide, but you can go check out curefa.org to help fundraise or whatever. And I guess at this time, we take a second, and we have these shirts. Are they all different? Robbie was really nice enough to request shirts, FARA shirts, for you all to have. Okay, do a little. Okay, so yeah, it's just, you have the website right here if you need it. So, yeah, are they all different sizes?
Medium, large, and extra large.
Okay, so maybe what we'll do is, since they're all different sizes, as you guys were heading out, we'll leave a few minutes, and you guys we'll pass out what sizes y'all want, okay? But yeah, she's got connections, so she was able to get that and just request it. I guess, that worked out. That was nice. And so this is FARA to show the pipeline of research, or how clinical trials actually come out. This is kind of like a pretty common pipeline. It's hard to read it, but it'll be on your...
This is on their website.
Okay.
There's curefa.org.
Oh, curefa.org. Yeah. Right. So yeah, you can see like the kind of when it's available to patients at what point. Okay, so they do research and preclinical. There's phase 1, 2, and 3, and then eventually it'll be available to patients. Okay, so this is the primary support for FA. And I'm trying to find a cure and treatment even. Okay, so FA is also promoted through cinema. Has anyone seen The Cake Eaters? No, okay. Okay. The Cake Eaters. Kristen Stewart from Twilight is in it. I don't know if anyone's a Twilight fan, but she plays a teenager who suffers from FA. It's a really, really great movie. We watched it together and ate cake. And why not, you know? And so she gives a really good performance. Her character's name is Georgia, and she's at the stage of progression she was in her mid-teens, Robbie. So really, watch that if you can. It's not, you know, it's kind of like this coming-of-age movie, and you know, she's interested in guys, and she wants to start dating, and kind of what's that like when she has FA, and showing just kind of a little bit of the progression. But it's actually really funny. It's a really hilarious movie, mostly then. But it also kind of brings awareness. It brings awareness to FA. Yeah, and Robbie was actually interviewed. Her and her sister and some other people interviewed for. I guess I don't know who it was. Would you say? Yeah, so you've been interviewed to get your.
Not to be in the movie, but to show the actor what someone with a baby. You know, where speeches like one women are like, just to be an example for them.
Yeah, and Kristen Stewart does a really good job. And then we also have some people who have FA. There's the Kyle Bryant, who is a really nice guy. He has
He's a spokesperson for FA.
yeah, and he has Friedreich's ataxia. It's called the Ataxian, right? Or he did the movie The Ataxian.
It's a little,
I have it. Yeah, I got the